Well, we are facing global changes in the world, and it could have a great impact on the public health of lots of different populations. The fact is, we expect that the major effects will be seen in communities that are connected to their natural environment, especially the coastal people or the people living in remote islands. Those communities are using the environment and specifically the ocean. Fisheries and fish is one of the unique sources of available food for a lot of people. More than 1 billion people rely on seafood for their protein and lipid sources. So given that those coastal groups are remote, isolated, means also that they don't have access to any scientific and laboratory equipment. So there is no way to monitor and to do a diagnostic of the environmental condition and health condition. There is no environmental monitoring of the water quality. There is no health surveillance. And that's the reason why we are in those regions to work with local people.
In the Caribbean, the true burden of illness is not known. So there are implications in terms of policy making, in terms of the economics of foodborne diseases, in terms of loss of wages, in terms of the health of the individual.
The Caribbean EcoHealth Programme has to do with water quality, burden of gastroenteritis, foodborne diseases, exposure to pesticides and persistent organic pollutants. So we'll do a big diagnosis of environmental health condition in those islands, hoping that the result will help the local stakeholders and the politicians to put in place better public health policies and to improve the situation.
We're very excited about the Caribbean EcoHealth Project and what it can do for Dominica and other Caribbean islands. We are quite interested in seeing the results from the various studies, the burden of illness, which will inform us as to the common pathogens associated with gastrointestinal illness. This will help us to formulate policy in terms of protecting our food supply, in terms of advising the public in what to do in terms of prevention. And we hope this will result in better, more targeted standards in terms of our own food production and food protection.
As you know, in the Caribbean, gastroenteritis is one of our most common syndromic illness. Most people get sick, and in most instances, people say, well, they think it's something they ate. But we really had no method of actually quantifying, well, is it really related to foodborne or not, and what percentage? And the burden of illness is attempting to do that. The study in the Caribbean consists of two major components. One is a population survey, standard written questionnaire administered face-to-face in the community at a population level, where we asked the questions pertaining to illness, if they got sick within the last 28 days, if the sickness was related to something they ate, what are their risk factors, and so on. It is hoped from the population survey that we get data like what % of the population is getting sick with gastro illness, and then what proportion of that may be related to food and waterborne illness. The other component is a laboratory component. To do this, we have strengthened the capacity of the countries to be able to isolate the major pathogens related to foodborne diseases. Before we did the burden of illness studies, countries were only isolating the common 1 or 2 pathogens. One of the impact of the burden of illness studies is we strengthen their capacity to isolate the 7 most common pathogens. And we did a laboratory survey for over a period of a year to be able to identify, well, what are the common illnesses, pathogens causing illnesses in the country.
The Masters in Food Safety and Quality will look in terms of a holistic approach from the farm right to the table, where students could either do the diploma and matriculate to the master's program in food safety and quality.
Dominica is recognized as the premier nature island in the Caribbean, and certainly one of the premier islands in the world for that matter. And so we're very interested in maintaining our environment in as pristine and as unpolluted a state as possible.
Within the Caribbean region, we have never been able to ascertain what levels of persistent organic pollutants exist within this region. It's very important because by the nature of the name itself, POPs, persistent organic pollutants, these pollutants, when released and caught within the environment, last for many years, in some cases decades. And so it's important for us to determine what level, if any, these chemicals exist within the Caribbean islands. We're also interested in looking at certain heavy metals, such as lead and mercury. A common source of mercury poisoning is in the fish that many people in the Caribbean eat. Again, this is important because whereas studies in the past have looked at mercury and lead poisoning in soil or air samples, not much, if anything, has been done looking at blood samples. And so throughout the region, the English, in particular the English-speaking islands, we have been taking blood samples from approximately 50 pregnant women within each island. We use those samples, blood and urine samples, to determine the levels of POPs, these persistent organic pollutants, as well as the levels of mercury and lead. Mercury, a common source of mercury contaminants is in the fish. Fish pick up the mercury, and when we eat the fish, it becomes part of us. And so, especially for pregnant women, this is an area of concern where the developing fetus, the developing baby, if exposed to high levels of mercury, can affect the neural development of that fetus, that baby. And so, again, we want to find out, well, what's in the fish? And there's a third component where we're also using the samples to determine if the person has had any zoonotic infections. So roughly 3 categories of contaminants. 2 are inert and 1 is live. A previous study done by Dr. Dewey in Bermuda had shown that not all fish have the same levels of mercury contamination. Some have far higher than others. And so what can be done, which was done in Bermuda, was a chart was made of which were quote-unquote safer fish to eat compared to other fish, the predator, the big, large fish, which had higher levels of mercury.
We broke off there, like a spine. Yeah.
The Caribbean EcoHealth Programme invited us to begin to participate about midway of the 4-year program. My role thus far has been to coordinate within our faculty, Ross University School of Veterinary Medicine in St. Kitts, those who have specialties in zoonotic diseases, infectious and parasitic agents. Firstly, the CEHP program indicated what they wanted us to look at. And we have been busy with 3 different disease agents that are important in the region. But we've been able to, together in this collaboration, expand the others that we will work with through our own collaborations and the collaborations of the CEHP. Basically, zoonosis, as we understand, are those diseases that are transmitted from animals to humans. And in the region, we do not know really, especially in this area of the Caribbean region, we don't understand foodborne, waterborne, and zoonotic illness at the community level. And we need that information to help people take the proper prevention measures to improve their environment, to understand where, for example, leptospirosis, one of the diseases we're looking at, is an indicator of contact with rodents. That's an example, pulling all of the components together, of how we can contribute in the knowledge being generated from this project.
Yeah, you see? So, okay, release it. Okay, good. Because when it is silicone, the silicone is like a gel. Yeah, so when you get in...
I'm here in Dominica to train the nurse from Dominica to do the work right here on this island. And we had a 2-day training. So the idea is to let them know all the steps that they have to do in research. So they are becoming a research nurse. First of all, they have to be aware of what is POPs and metals, heavy metals, because we are looking at those in this survey. They have also to understand what is the ethics committee, the steps we have to go through ourselves to submit protocol and informed consent form. After that, they have to understand that informed consent form is very important, that the mother has to read it and understand it. They have to answer to their questions so they can be volunteer in that study, the participant, and here in the study is the pregnant woman.
The silicone you stop, you can already pour what you have.
So they've been recruited from the place where they work, and they have to be affiliated to either an hospital or a ward where women go for delivery. And as long as they are selected, they are recruited to do the work with us on the POP survey.
So in a nutshell, the microbiological studies that will be undertaken here are twofold. On the one hand, we'll be implementing the projects that basically come with the Atlantis Mobile Laboratory. So these are standard protocols that are carried out from island to island. And as far as the microbiology is concerned, we'll be interested in looking into the bugs that are responsible for food poisoning and gastroenteritis here in Dominica. As the Ministry of Health's capacity to identify those bugs is limited to essentially 3 bacteria, we'll be looking in at least doubling that capacity and trying to cover the ones that are likely to be the most responsible for these illnesses. Now, on the other hand, there are also other microbiological studies that will be undertaken that are not undertaken necessarily in all the countries in which the laboratory is found. And these have to do with the bugs that are responsible for hospital-acquired infections, and we'll be looking at antibiotic resistance and which are these bugs that are causing these hospital-acquired diseases. We'll also be looking at the quality of bathing water, whether it be beach water quality in terms of microbiological quality, and also freshwater bathing waters, knowing that the tourism industry is a really important source of revenue in Dominica. It will be important to see that these waters are of good quality.
There are a lot of people who get sick, and sometimes we don't know what is causing the problem, and maybe it's the water. So if we know what is in the water, then we can there may be policies that can be done by the government to clean the beaches and prevent people from throwing feces or rubbish or tying animals near the rivers and near the sea.
We will also be looking at the quality of freshwater catchments that go into the waters that make up the potable water. So the water that in the end is being drunk by the people in general, just to make sure that these catchments are safe to start with.
And that's why Atlantis was conceived. So Atlantis is basically a laboratory or a small university moving from a place to another one. Atlantis was used mostly between 2004 and 2006 in the Arctic and subarctic, and now for the next 4 years between 2008 and 2011 will be used mostly in the Caribbean.
This facility is used as part of the program to conduct research at the national level. And we would look at the priority areas where our lab and our program can assist the countries at the national level. When the Atlantis Mobile Laboratory first arrived in the Caribbean, there were a lot of national initiatives in terms of capacity building and research, both in health and the environment. The capacity building mainly functioned around allowing boarding laboratory technicians to develop the analytical skills to work at clinical and environmental laboratories throughout the island.
There will be technology transfer and skills training for our technicians who are presently employed in our ministries or government agencies, as well as perhaps some of the private concerns, so that as we go along in the near future, we can build the capacity in-house on island to maintain monitoring of the environment and the health of the people.
So we hope we'll be able to transfer some easy-to-use technologies that will need only little investment and also maintenance. So kind of capacities that can do analysis in a short period of time. And if there is something, then you can confirm with more sophisticated technologies.
A real challenge is really to get the test not to the level of the science, but get the test to the level of the humans who are going to use it. And I really think that interacting very frequently with the populations who need to perform these analyses is the only way to develop a sustainable technology that will eventually be perform on the field. Whether it'll be in 5 or 10 years, I don't know, but I'm sure we're progressing towards this goal.
Atlantis is also a place for hosting students for all over the world, and especially from the Caribbean. So we really are happy to have these students coming and do their master or PhD degree with us. But we also have a training component for laboratory technicians. So we are training currently technicians in microbiology, but also in analytical chemistry. All right.
Well, the model that we're trying to build is, or to test, to implement, is to see how research can be done in full collaboration and partnership between researchers and programmers and decision makers. What we're trying to, the culture that we're trying to facilitate and to build is to enable people from different disciplines, from the research area, from the decision and policy making area, from the public health management perspective, to enable people to work together and to look at the public health issues and problems and concerns as with an interdisciplinary approach, so that they can better and more effectively solve problems of public health significance.
These projects have brought together professionals within ministries and also between ministries, and as well as internationally. And so within ministries, for example, both the POPs and the BOI studies have involved the people interested in environmental health, the epidemiologists, and the professionals working in the labs, and created an opportunity and a larger program for them to feed their expertise into and have multidisciplinary conversations. And so that has really broken down some of the silos that have existed between those departments, and having these big regional research studies, I think, is really valuable in that regard. So the Caribbean EcoHealth Programme is working with Ross University and St. George's University and the University of the West Indies, as well as a spectrum of national governments, and creating those strong connections between university researchers and national government priority programs has been really, I think, a valuable thing that we've been able to cultivate. We've invested, and our program has facilitated conversations between the Caribbean Epidemiology Center and the Caribbean Environmental Health Institute and the Pan American Health Organization, between themselves and the national governments, and also with actors like the Public Health Agency of Canada, who has been able to develop new relationships and look for opportunities for synergy about common health issues of common concern. One of the things that we've done that has been really particularly valuable is doing large regional studies. And so the POP study and the burden of illness study are examples of multi-country, upwards of 8-10 country studies using similar methodologies. And so what that is creating for the first time is some really in-depth, high-quality regional data sets that have the potential to influence policy not only at the national level, but also regionally and internationally. Another key element of knowledge translation has been the improved surveillance, and in some cases just initiating surveillance programs. For example, initiating surveillance in the maternal blood in the POP study, and that's creating a data set that hasn't existed before, that will really enhance the ability to detect and prevent health problems in the populations of the countries that we've worked in.
And I'm thinking about the fact that when we started with Atlantis, we started actually in Bermuda in 2003. And we did a cord blood study with babies. And one of the things in Bermuda that was really interesting and important was the high concentration of mercury in the blood of babies. So that was one of the most important results. And those results were transferred to the government. And they issued a cabinet paper within a few weeks, asking the health department to inform pregnant women, to start to consume smaller fish and not eating the big predatory pelagic fish that are known to contain a lot of mercury. And I was very happy because in 2010, we were able, so 7 years later, we were able to see a major decrease in mercury exposure of these babies by more than 80%. So for us, it's very rewarding to see that with the research well transferred to the decision maker, you can do something. And of course, much more recently, data that just came out from the Caribbean, the work done in different islands, especially in Barbados, with this issue of mercury.
So we sampled about 50 people, about the same number of men and women, and we had 20 women total. And out of those 20 women, we had 4 ladies that had really high levels of mercury. They had about 2,000 times the average that we found. So it was about 5 ppm that we found in the hair, and they had about 4,000 ppm in their hair. So we knew it was an external source. By interviewing them, we found it was from a cream, a bleaching cream that they put on their skin, their face mostly, and their neck. We tested the cream for mercury. It was about 3% mercury in the cream. That cream came from Jamaica. So we wrote to the Chief Medical Officer of Barbados. We also wrote to all of the Chief Medical Officers of the Caribbean, hoping that they're going to ban this cream from the market and hopefully explain to the people as well that the effects of mercury and why they shouldn't use these creams.
And at the end of the process, the hope is that you give your result to the community, but you also translate in understandable manner that could be also translated in local policy at the community level or at the entire country level. So we have discussed with civil service, high rank public health authority, and there is things to do, So knowledge just fuel better action. So that's the reason of this kind of study.